When you are caring for someone who is acutely unwell, it is hard to sometimes look at them as a person and not just as a bunch of observations.
Healthcare is very task orientated. There's a lot to do, and sometimes we get caught up with almost ticking off all the activities we have to do. Have you done the medication? Have you done the obs? Have you changed this dressing? When often we don't stop and say, well, how are you feeling today? Do you want to have a shower? Or maybe you just want to have a rest. Do you want me to take you for a walk today?
You make a transition straight away. The minute you take your outdoor clothes off and put on your bed clothes, you suddenly become the patient.
You're only known as a patient with a name above your bed and the date you came in and the potential date you'll be discharged. So they do need to know who you are outside of this confined area.
And I'd say to the night nurse, will you have a look and see how my bag's going in 2 hours? They wouldn't do it. And then the bed would get in a mess because I haven't woke up. I say, not likely to wake up in a couple of hours or something. And then they'd come in and, oh, yes, they'd fixed up the bed and that, but they'd leave me in the cold trying to put my bag back on and clean up things like that.
You hear the doctors round coming down the corridor and you see them going to one room and the next room, and they finally get to you and the doctor comes in, and so many times a doctor would come in and he would open up the dressing, have a look at the wound, have a bit of a poke at it, then close it up and then talk to you and go out of the room again. And you sort of think, where has he been before? The gloves are there, the basin's beside the bed, the hand wash stuff's there. When's he going to wash? Is he going to take what I've got into the next room, or have I picked up something from the person before? And particularly when I had a wound that wasn't healing, that scared me a bit, and I just sort of felt, well, if he really respected me as a patient, at least he should do what the nurses do and wash and put on the gloves and dispose of them, and it wouldn't really take him that much more time. And that became fairly scary.
When the doctor came around visiting, he'd often come with a team of trainee medical students. And I remember sitting in the chair and he said hello to me, and then he turned his attention to my leg, and particularly my foot, which had a tendency to drop. And he proceeded to talk to the medical students about my foot and how, you see this, and how the foot drops, and that'll never get any better. And here I was sitting there listening to this and taking this in. Now, you can imagine by my comments that it's impressed in my mind a little bit. But remember, I was very positive at this stage. People who were not so positive about such things might have an adverse reaction to that, and really set them back instead of encourage them to come forward and get better.
With the medication Mum was on, she was seeing things, doing things, pulling out her tubes from her arms, verbally abusing people. She wouldn't kill a fly, let alone doing anything like that. And they just wouldn't believe that it wasn't your mum. Let them know what you're doing. I think that's a very important thing. Just don't give them an injection, say, well, you need that. What is it? What would it do? How's it going to affect me, or what, Why am I taking all these tablets? What's this blue one for? What's the red one for?
I think we need to really understand that there's a lot more to each patient than just what you see in the care of the hospital system.
The people who do come in and treat you as a person with a family, with a history, with a life, you respond to so much better. There's a link, a communication that takes place.
I find that the families and the carers who come along to us with the patients have a wealth of knowledge. And when the patients can't tell us what they need, their carers often can. When that family member comes in and they know that Dad walks better when you do this with him, or Dad can only walk so far, or the next time you do it, if you step him this way, that's what we find that works. And listening and sharing and listening to the patient as well, but when they don't have the words, the carers often do.
Families, as the patient's number one support, quite often they'll come to us with questions that you wouldn't have thought that they would talk about.
They've got to listen to the family in that situation, and it's very hard if they don't, because you do know that person better than what they do. They've only met that person only just then.
I think of one doctor in particular who has just been incredible. He'd sit down and get to you an eye to eye, would ask you one question, a simple question, how are you coping today? And he'd give you time to answer. Just speaking to you as if you were a normal person. I could have been in my lounge room, I could have been anywhere, but he showed he cared.
You need to dispense with the idea of running to time and doing all the physical attributes for the patient, and look for the soul and the person inside that body. Only takes that and you've got the whole trigger to the willingness to come forward and recover.
Functional decline is a serious problem for older people in hospital. It can affect a person's ability to perform day-to-day tasks and their independence, which can lead to a longer stay in hospital and increase their likelihood of needing admission to residential care. Fortunately, there is much that we can do. We know from the evidence that outcomes for older people in hospital are better when everyone involved in their care takes a person-centred approach and uses best practice. Often, it is the small things that make a difference. Treating older people with respect and dignity, treating them as partners in the healthcare relationship, listening to them, their families and carers, letting them know what you are doing and why, taking the time to get to know them and treating them as an equal. By taking a person-centred approach and using evidence-based practice as explored in the Best Care for Older People Everywhere toolkit, we can minimise the risks and improve outcomes for older people. To access the toolkit, go to the website